we'll first take a look at the overall numbers of coronavirus cases in India. Well, the number as of this moment stands at 1,96,262. 5,727 new cases have been reported so far. That's the latest update that we have. In fact, the one point that needs to be mentioned here is that in Delhi, the number of cases have crossed 20,000. In Maharashtra, it is at 70,000. That's the total numbers that we have. This is the updated numbers that we can share with our viewers. But what really was the suggestion that was made by Arvind Kejriwal, as he says that Delhi is going to seal its borders once again at a time when there is Unlock 1 happening? Let's first listen in to what Arvind Kejriwal's suggestion was.
क्या दिल्ली के बॉर्डर्स को खोला जाए? दिल्ली के अंदर कोरोना के केसेस काफी बढ़ रहे हैं कि दिल्ली के अंदर सरकारी अस्पतालों में सब कुछ मुफ्त है। आपका 10 लाख रुपए का भी अगर कोई ऑपरेशन होगा तो वो भी मुफ्त है। तो पूरे देश भर से लोग यहां इलाज कराने आते हैं। जो आज मैं आपको कह रहा हूं कि 9,500 बेड्स हम लोगों ने आपके लिए रखे हुए अगर कोरोना हो जाता है, जबकि आज दिल्ली में केवल 2300 पेशेंट्स हैं। ये बेड्स तो 2 दिन के अंदर भर जाएंगे अगर पूरे देश भर से लोग दिल्ली के अंदर आ गए तो।
All right, now let's also quickly tell you what Arvind Kejriwal has done. What is his logic? Basically, he says that border opening is taking place, but coronavirus cases are rising. And can Delhi really open up its hospitals for treatment for everyone across the country? There will be a huge logistical issue if something like this has to be done. It will put pressure or capacity. It will be very difficult for the hospitals to manage this sort of a capacity, and thus raising a very important question, which is still in a suggestion phase. It is not a discussion. It is not a decision. I'm repeating myself again and again. Should Delhi's hospitals be reserved for the Delhi residents? I want to introduce all my guests this evening. Raghav Chadha, MLA and spokesperson of the Aam Aadmi Party. Geeta Bhatt, political analyst with us. Aman Pawar, spokesperson of the Congress Party. Dr. Rajinder K. Dhamija, Head of Neurology, Department of Lady Hardinge Medical College in New Delhi, and Dr. Anup Kumar, HOD Urology of the Safdarjung Hospital. Thank you so much, all of you all. Raghav Chadha, we'll begin with you first. Can you explain in simple terms the logic? I have understood the broad strokes of this suggestion, but what about the minute details? For starters, if I were to ask you, say for instance a person with an ID card from Meerut were to come to AIIMS or any other hospital in Delhi in a severe condition, do you propose to send that person away?
Well, at this point in time, Sanket, a decision to this effect has not been made. The Chief Minister of Delhi, in a form of for participatory democracy, has gone back to the people, has sought suggestions and their opinion as to how do we deal with an issue like this. Now, the issue is very, very simple, and I think anybody with a rational mind would understand this. When the lockdown was imposed in this country, every state was given an opportunity to ramp up its public health infrastructure. The government of Delhi has also built public health machinery as well as enhanced its capacities over the last 67, 68 odd days of the lockdown. And we've got our PPEs, ICU, critical care equipment, as well as the oxygen beds in place. Now, these capacities have been built keeping the following in mind. 1, the population of Delhi. 2, the infection rate in Delhi. And 3, if matters go from bad to worse in the city of Delhi, will the public health infrastructure be equipped to deal with a situation like that? And we have checked all our boxes. Now, a situation has arisen where the lockdown is being undone and borders are being opened. We fear that it will attract a huge influx of patients from different parts of the states who will come to Delhi for medical treatment. Now, the question before is that will that lead to the exhaustion of the medical capacities that the government of Delhi has built over the last 67 days? Would that mean that Delhiites, the people who live in Delhi, will not get treated at hospitals in Delhi? So the big question that we need to ask ourselves today is that who has the right of first refusal? And I think a decision to this effect has not been made. And let's try and understand this with the help of a very simple example. If, God forbid, there is a huge fire in Delhi and a fire in Uttar Pradesh also happens at the same time, the fire department of Delhi, the fire brigade and the firefighters will first obviously cater to the fire that has happened in Delhi,
Okay.
extinguish the fire, and then go to Uttar Pradesh
Yeah,
and
fair
cater to
enough.
the fire in
I
UP.
get the logic.
Now, so therefore, I think the idea is, and in conclusion, Sanket, let me say this, that the Uttar Pradesh Chief Minister said that UP is facing coronavirus due to Delhi, and therefore he sealed all his borders. In fact, shut down every village, destroyed the road infrastructure of every village in order to ensure that villagers don't step out and do not reach Delhi. They are doing this for the well-being of their own people. The Chief Minister of Delhi is doing this for the well-being of the people of Delhi.
Okay.
And by people of Delhi, I mean anyone who lives in Delhi. All of us have come from outside. Some have come from UP.
No,
from
fair
Bihar,
enough. So
Rajasthan,
when you mean
Punjab,
a
etc.
Delhiite, it would
Whoever
mean
lives in
someone
Delhi.
who has an iCard with proof that he is a resident of Delhi. Fair enough. I understand that point.
It hasn't been defined yet.
It has not been defined yet.
Articulated
Clear.
yet because it is in a very preliminary
Proposal stage.
where the Chief Minister
That's a
is
health
speaking
warning.
to,
We are
his
repeating
people.
this again and again. This is a proposal. It has been proposed by the Chief Minister. It is not a decision. I'm going to repeat this throughout the broadcast. But Aman Pawar, let me come to you. You've heard what the Aam Aadmi Party's Raghav Chadha has to say. He says that Delhiites should have the first right to refusal. They should be the first claimants to the health infrastructure that has been built over the past few months to deal with COVID-19. How would you respond?
See, Sanket, firstly, I think that what the proposal Arvind Kejriwal has given today is nothing but to divert attention from the real issues that the people of Delhi are facing in these crises. We have seen a lot of public hue and cry that how people are not getting beds, how they are not getting treatment in Delhi government hospitals. And to divert attention from there, Arvind Kejriwal has, propagated this idea, which I think is very irrational. And why do I say that is because in Delhi government has about 11,000 beds in their hospitals and the central government has about 13,500 beds in the central government hospitals, which is AIIMS, Safdarjung Hospital, Ram Manohar Lohia, Lady Hardinge, etc. So tomorrow if the central government says that we will only allow people from outside Delhi to use these hospitals and these beds and let Arvind Kejriwal put all Delhiites in hospitals which are under Delhi government, I mean that will again lead to a chaos. Delhi is the only state in the entire country where the central government has such a massive infrastructure. It spends 3,500 crore rupees annually on hospitals.
Okay.
And let me tell you now, let me give you their own figures. Now in Delhi, there are 42 people who are on ventilator as on today, as when we speak. I'm talking about the figures today evening. And how many are admitted on ventilator in Delhi government hospital? Only one. Rest are in either private hospitals and this is or in central government hospital. Let me tell you more.
Okay, no, one moment. First, let me take the opening comments of everyone.
Let me just give me
Mr. Pawar, one moment. You made certain interventions.
In Delhi.
Before I give Raghav Chadha the right to reply, very quickly, I want comments from each of my panelists. Geeta Bhatt, very quickly. What do you feel about this proposal? Again, I repeat, proposal. Not decision, proposal.
Yes, of course. Sanketji, see, very quickly I will say that, in these very unprecedented and tough times when the state governments should be focused on their administrative competence, coming out, in announcing a decision and then trying to create a controversy is something which maybe is typical of Mr. Kejriwal. After all, he's the one who had once said that I am an anarchist. Now, coming to the facts, if this decision is implemented, what it means is that if an army soldier is traveling from Jammu to Madhya Pradesh and if he takes a break of his journey in Delhi and God forbid he falls sick, the Delhi government is going to refuse any kind of treatment to him. Sanket? How much inhuman and inhuman and insensitive it can get? Can a state government have this kind of a response to any citizen of the country?
Okay, how can the government have this sort of a response? We've heard Geeta Bhatt's opening comments also. Very quickly, Dr. Rajinder as well as Dr. Anup Kumar, the two doctors on the show. Dr. Dhamija, we'll begin with you. What do you think about the proposal? Can it be implemented? Can it be tweaked to be implemented? What do you suggest?
Sanket, we as a doctors, when we step out of the house every morning and go to the hospitals, our mission is only to help the patients to get better our patients. We do not, ask the patients, or we do not, the patient, whether it comes from place A or place B or place C, has no bearing on my treatment or my level of care to these patients. Having said that, the virus does not discriminate between rich and poor and place A or place B or all these considerations. So we are fighting a war. We have to fight it collectively. So health inequality and health inequity, these are not desirable in these times. And as a clinician, I'm concerned about the rising numbers, and these numbers are not rising as of today. These numbers have been rising steadily and slowly for the last few weeks. And as a public health expert, my main concern would be what is the rate of infectivity, why these numbers are rising, and how to contain the hotspots. What is the proportion of patients who are asymptomatic? What is the proportion of patients who have had infections or prevalence, and so that I know where are we heading towards herd immunity. So lastly, this all for us, patient is a patient. We treat these patients irrespective of their.
So you can't differentiate between the patient, says the doctor. Dr. Anup Kumar, very quickly, what about you? You're the HOD of urology at Safdarjung Hospital. What about you? Dr. Kumar, can you hear me?
May I, Sanket?
Yeah, just one moment. I want to take the opening comments and then I'll come to you, Raghav. Dr. Kumar, can you hear me? Okay, we'll try to fix this audio and then come back. Raghav Chadda, you have heard the opinion of Mr. Pawar, Geeta Bhatt, also of Dr. Dhamija, who says doctors can't differentiate. So I'm asking you certain very practical questions. Now, take these as suggestions if you can, because obviously Arvind Kejriwal has asked for suggestions. So what if there was a situation that somebody comes to the hospital, does not have an ID card, but is in very bad shape? Will the hospital turn that person away if he's from a different state?
So, so first of all, this is a proposal. No policy has been spelled out or defined, and therefore I think these examples should only be raised once the government actually comes out with a policy. And at this point in time, the government has not stopped any hospital from offering treatment and care to anybody. All we have said is that let's keep the borders sealed for the time being until we arrive at a conclusion as to what capacities of the existing public health infra in Delhi can be offered to those who wish to avail its treatment from outside the city of Delhi. That's one. Number two, it's very easy to make these statements, Sanket, but fortunately, none of the panelists on this show, neither Mr. Pawar nor Ms. Bhatt, and neither those two doctors have been instructed to govern and be in charge of the welfare of the people of Delhi by the people of Delhi. It is Arvind Kejriwal, and therefore it is his responsibility to ensure that the people in Delhi Delhi should get the best possible treatment. Now, let me just give me a few minutes. Everybody has made statements against us.
No need to be that arrogant.
Okay, one by one, please. Raghav, let him finish his point, and then I'm going to come to you.
You see, these are, Sanket, nobody has said that this is a precedent that we wish to, put in place, or this is something that we will do on an ongoing basis. The limited point we're trying to make here is that this is an extraordinary time, which calls for extraordinary measures. In fact, I would like my friend from the Congress to rewind to Sheila Dikshit ji's days when she was the Chief Minister of Delhi. She had come out with a policy that all Delhi government aided colleges should have a reservation of up to 90% for the people of Delhi. And I literally came out with that policy. At that point in time, there was no pandemic, and this decision wasn't taken in the interest of the health of the people of Delhi. So what I'm trying to say is that the Congress, out of all the parties, should not speak about this. And lastly, you see, every chief minister cares about his or her own people. Today, as we speak, the DM of Gautam Budh Nagar, that is in Uttar Pradesh, has issued an order saying that the borders of UP will not be open for the people of Delhi to come. Gurgaon's border have also not been opened. So Haryana and UP are also trying to protect their own people. What we are trying to do is have a consultative approach, follow the mode of participatory democracy, and try and understand what we can do when there is an influx. Now, you would certainly bear this in mind
that capacities in Delhi have been built, keeping in mind the population of Delhi and the infection rate in Delhi. Tomorrow, if people from every state come to Delhi for treatment, of course the capacity
No, my only, okay, fine.
What do we
Raghav, I've
do
heard
then?
you. Raghav, I've heard you. My only fear with a
Sanket, can I
proposal
answer?
like this is, very quickly, before I come to you, Mr. Pawar, Geeta, but my problem is that while you may criticize this, but see, this seems to be a sort of a protectionist policy. It is protectionist in nature, that my people first, my state, my people, my voters first, right? Now, what if a Maharashtra were to do this for Mumbai? What if a UP were to do
Yes.
it for people in Lucknow? What if every
Yes.
state starts doing this?
Yeah, Sanket ji, two very quick points I want to make. First is that, even in Uttar Pradesh and in Haryana, the chief ministers are duly elected by the people of that state. Now, and also, you see, if this decision has been taken, it is based on certain, facts. In Noida and in Greater Noida, 43% of the cases were related to Delhi. In Haryana, all the three districts which are close to Delhi, and that is which fall under the NCR region, Gurugram, Sonipat and Faridabad. 510 cases have been reported from there. In the
That
rest
is
of the
to protect
19
their
districts,
people.
there are only 25 cases. So,
To
no
protect
one
the
is, if
people
you are
of their
sealing
state,
a border, if there is a logic to it, if there is, then of course the state government can take a decision. No one is criticizing that.
No, but
the
then,
fact
but then,
remains
but then,
is
Geeta
that
Bhatt,
is it
Geeta
because
Bhatt,
that
what
there
is
are
the answer
so
to
many
this
deaths
question? Aman
taking
Pawar,
place
one moment. Aman
unaccounted?
Pawar,
There is a big controversy
what is the
about
answer
it.
to this
exactly
simple
what I'm
question
saying,
that
Sanket.
once the lockdown is lifted, we know how people come, they flock to the national capital, they flock to New Delhi for medical attention. The facilities here are better than the rest of the country. We have to admit this. And you will not be able to stop that trend. People will come because everybody wants the best. At a time like this, your medical infrastructure will crumble. Even if you have 1 lakh beds, it will crumble because people will start pouring in. How do you help
See,
the
Sanket,
cause? How do you
if-
support this?
Sanket, if that is the logic, then why at all lift the lockdown in Delhi? You are allowing people in Delhi itself to move all around, and then you say that we have been building capacity to protect them. Now let me tell you the capacity that they have built. Out of the 42 people who are on ventilator in Delhi, only 1 person is admitted in the Delhi government
No, that
hospital.
you
And I'm
mentioned,
speaking
which
this
Raghav Chadha says is not true.
from statistics. Let me give
It's
you
not
more
true.
figures.
Just go through the health
Out of the
bulletin.
total
Sanket, just put out the
219
health
people
bulletin on your channel
who
and
are
you'll
in
know.
ICU
One moment.
in Delhi.
You will have a right to reply.
Raghavji, please. Raghavji, please. Out of the 219 people who are in ICU in Delhi, only 76 are admitted in Delhi government hospitals. Rest are either in private hospitals or central government hospitals. Out of the total positive cases which are hospitalized in Delhi, there are 2,748 cases which are in hospitals in Delhi. Delhi government hospital only admits 899 cases. So if your capacity was so good, till now what were you doing?
Okay,
Why did you not admit
very
all
quickly,
these
Raghav
cases?
Chadda's
No
right to
hospitals.
reply very
So you
quickly, and I have to go to the
let me-
doctors
let
as
me
well.
complete.
Yeah,
And the
first-
central
first of all-
government,
first of all,
Raghav,
the
Sanket,
central
now,
government
isn't
aims
it my
meets
opportunity?
Safdarjung
One
hospitals
by one,
are in
please.
May I-
Raghav
may I-
Chadda.
facilities.
Sanket
Very
ji, the
quick,
air,
right to
air
reply.
traffic is
I think
already
these-
open.
these
Trains
figures-
have already
these-
started. People, are
May
you
I-
going
may
to
I now-
shut
These
down
are
the
figures,
airports
these are
and
Delhi
the
government
railway
figures.
stations?
Why are they
Raghavji, these
Geeta
Delhi
Bhatt,
government
one by one,
figures,
please.
government
One by
figures I'm
one.
talking about. Delhi government figures.
May I-
Raghav
Sanket, may I
Chadda,
now
Raghav
make my
Chadda,
point?
Aman Pawar seems to be showing
Yeah.
Delhi government
Yeah.
figures.
Yeah, no. First of all, you have access to the health bulletin of the government of Delhi. Please put it out. I can't validate these figures
Yes,
for him, and
this
I don't
is
wish
it.
to comment
This is
on
it.
them
I
simply
have it
because
in
I
my
don't know
hand.
whether they're correct or not. But let
think
me
you are sleeping,
make a
you are
very
not doing your
significant
homework.
point. You
That is why
see,
we are
may
in
I
this
just
situation.
may I-
One-
may
one
I
by one, please.
Please
Yeah.
relax. Let me just speak. You see, Sanket. So much hue and cry about a referendum that the chief minister is doing simply goes to expose
What have you done
the
till now? That
gross
is the question.
underpreparedness. May I just finish? This goes to show the gross underpreparedness on the part of Haryana as well as Uttar Pradesh and perhaps even Rajasthan. That is why, in order to hide their inability to build public health machinery over the last 67, 68 days, that they are now shouting at the top of their voice, criticizing the government of Delhi for not
Okay,
building
okay, very
infrastructure
quickly,
for
back to the
their
doctors.
people.
Dr.
You
Anup
want
Kumar.
the people, you want
You don't
the
have an
government
answer,
of
Mr.
Delhi.
Yeah,
Chadda.
one more.
Infrastructure
Before we
is
get
being
into the
built
prepared
politics,
next time.
Dr. Anup Kumar,
What are
Be
your
better
chief
prepared
ministers
next time,
doing?
Mr.
Raghav
Chadda.
Chadda and Aman Pawar, one moment. One moment. Dr. Anup Kumar, sorry we lost your connection. I just want to ask from you, Dr. Kumar, just like Dr. Dhamija said, that we have taken an oath. You can't really push a patient away for any reason. If he needs medical attention, the medical attention must be given. Dr. Kumar, what do you make of the proposal? Again, I repeat, proposal, not decision.
See, Sanketji, this is a very, very critical period which is going in the whole country. This month and the next month is going to be a very critical period for corona pandemic in the country. We as doctors, as Dr. Dhamija said, we never distinguish between the patients who are coming from different states or whether they are from Delhi. For us, they're all patients and we need to protect them, we need to cure them. So I think this is a time where all should come together instead of fighting with each other, and we have to fight this battle together. This is a really very, very difficult time. And I just want to say, we doctors always take this Hippocratic oath that we have to protect our patients of any caste, religion, or any region he comes to us. We have to protect them. So for us, they're all same. And in Delhi is as you know, is a very, very advanced state for medical facilities, and we get patients from all across the country. And this has been going on for many, many years. And I think Delhi is so open-hearted that we have always welcomed them and we have always treated them. So I think this is a time that we all should work together as a team and we should fight this battle.
No, but then Dr. Kumar, what about the medical facilities? I mean, see, the point is the way the influx will happen, even on under normal circumstances, we see people coming to Delhi. Everybody wants the best of medical care, right? People come to Delhi, people come to the national capital in the hope that they will get good medical facilities and treatment. Yes. Now, at a time like this, in COVID times, how do you create or make sure that you have the capacity? After all, how many beds can you prepare? We'll come to the point on how many beds were promised and how many delivered, because that's a political point, political argument. But how do you prepare when you don't know what the influx is going to be?
So you're right, Sanketji. Like once we open our borders and we will have influx of the patients coming from the neighboring states. And I hope that all the states are really working on this issue of building up this infrastructure and building up more and more facts.
So if people work as far as COVID-19 is concerned, or Dr. Dhamija, would you agree that if neighboring states were to create a medical infrastructure in such a way, and they can perhaps guarantee to Delhi that we have XYZ number of beds, then people will not flock. People will not come to Delhi.
Sanket, I think we are in a much better position now as we were three months ago. We have built up infrastructure in terms of testing laboratories, or whether it is bed strength, or it is ICU beds, or it is ventilators. We are much, much better. At the end of the day, we all know that 80% of these patients will not require hospitalization. These are the asymptomatic or mildly symptomatic,
and they can be
will not be
so much pressure on the infrastructure.
But having said that, of course, it's all collective responsibility of all the states and the national level. We have to create and augment existing infrastructure as of now.
I will answer.
It boils down to coordination. Raghav Chadda, my point is, Raghav Chadda, the argument that, or the proposal that has come about from Mr. Kejriwal is on the basis of a fear that what if a lot of people start coming in. It's an absolutely valid fear. It is in the realm of possibility also.
It is certainly in the realm of possibility, and in fact that figure and the calculation of the health capacities in Delhi has been made not on the basis of 20% of the overall infected population requiring hospitalization, but less than that. In fact, our calculation is not 20%, but perhaps 8 or 9% of the overall infected population that may require hospitalization and
but what about the allegations, Raghav, where the Aam Aadmi Party has been accused of having promised so many beds, and not having delivered?
I'll answer that. When on the 23rd of March, when the entire lockdown was imposed on this country, the oxygen beds and the ventilator strength of the government of Delhi was only 600 or 700. Today we are standing at close to 10,000 oxygen beds in the city of Delhi, and we have prepared, we've broken down the entire thing into 3 sects. One is the best case scenario, second is the bad scenario, and third is the worst case scenario. We are preparing for the worst and praying for the best. And let me say this, that, it is not a question of open-heartedness. It is a question of pragmatic preparedness. And the fact that BJP and Congress chaps are shouting simply goes to show their underpreparedness. Why should, I would say, that the Chief Minister of Delhi prepare or pay for the underpreparedness on the part of UP, Haryana,
important point
Rajasthan
made.
and Punjab?
Yeah, one more. Let me take a response. Aman Pawar from the
Why
Congress,
haven't they been,
from neighboring
let me just
Rajasthan
respond to the
and Punjab.
Let me just look,
Yeah.
Sanket, to the doctor, please, if I may. Look, we have not for once said that the doctor has to violate the Hippocratic oath. If the patient reaches the hospital, he will get cured. He will be given medicine. Nobody is so inhuman. The fact is that one is trying to deliberate on a policy how to control the influx of patients into Delhi, and so much pressure on the limited capacity.
Okay, Aman Pawar, very quickly. Aman Pawar, the fact that there is a fear that
preparations-
people will come to Delhi is actually a reflection, Raghav Chadha says, on the lack of preparedness on the parts of various state governments. Aman Pawar and then
No,
Geeta
no,
Bhatt.
Sanket, the question is, if their preparations is very good, then how come there is only one person which is admitted in the Delhi government hospital on ventilator, rest are in private hospitals? How come only 30% people who have COVID positive are admitted in Delhi government hospitals, rest are in private or central government hospitals? And let me tell you, out of the 2,700 patients which are admitted in AIIMS Jhajjar, 702 are from Delhi. They have gone from Delhi to Jhajjar. What will they do? And what about the central government? If
No,
they
that is
say
actually
our
my
hospitals,
fear. My
AIIMS,
only fear
AIIMS,
with this
RML,
proposal is
Safdarjung,
that
and
everybody
all
will
these
start
hospitals
implementing
will be
this
utilized
proposal.
not for Delhi
Or consider
patients.
this.
What if the central government puts this condition that Delhi patients will not be admitted in AIIMS,
Okay, lot of
Safdarjung,
what ifs.
then where
I
will they
back
go?
to Raghav Chadha very quickly. Geeta Bhatt. I have to take a small break
Yeah,
also. Geeta Bhatt.
Sanket ji, I just want to add here is that the air traffic is already started. Trains have started commuting. Now people are going to. Is the Delhi government going to put a ban on these? On the air travel and on the trains? And how is it the kind of deaths? Things are absolutely not right in Delhi. We all know that. That is the true situation. So is it that the attention is being diverted from that because the number of deaths which are taking place? The disparity in the data that is being given by the Delhi government and what is there by the municipal corporation, there is a difference of almost 3 times over there. So
May I respond? No, this is an allegation to which I need to respond.
Yeah, one by one, please. I have to take a short break also. Otherwise,
the preparedness of other
one
states.
moment. I am going to.
This conclusion has been drawn by the Delhi government.
Geeta Bhatt, one
that
moment.
the
I have
other
heard
states
your.
are not well prepared.
I have heard what you have said, Raghav. Before I come to you and also the doctors, I will have to take a small break, short break, and I'm going to be back in exactly a minute from now. Short break. Be right back. All right, now for the closing comments, very quickly, let's quickly go to Dr. Anup Kumar. Dr. Kumar, see, there is a problem. There is a problem. If there is going to be an influx, there will be a problem. There is a genuine fear that the health apparatus may collapse. Short of stopping people to come to hospitals, what else can actually be done according to you? Solutions. Let's talk about solutions.
So, Sanket ji, you're right. This is a very difficult time for all the states. The numbers are increasing not only in Delhi but also the NCR areas. So, it's a collective responsibility of all the states to build up their infrastructure. So, if you're talking about other states, they're also building up the infrastructure. So, one thing is very important, that if we start restricting the patient from one state to other state, that might lead to some problem. So, we have to find out some cohesive solution so that all can work together to solve this problem. So one thing is to build up infrastructure in your states, and of course Delhi and our central government is already working to create infrastructure in Delhi. They are further increasing it to a higher level. So I think all states have to do like this.
Okay. Very quickly, Dr. Dhamija.
My point of contention is that we are talking about numbers today. That is why all this debate is going on. So we need to work aggressively on containing the hotspots, very aggressive efforts for micro planning, so that we can work on these areas to prevent the spread, so that these numbers do not grow exponentially.
Okay.
So that is what I'm concerned about. I'm also concerned about the asymptomatic carrier. We need to work on that. We need to find out how many people are infected at the moment and how many people have already been infected. So that gives an idea of total percentage of people in the community having infection. That may help us to see whether we are going towards herd immunity.
Okay. So at this moment, let me thank both the doctors, Dr. Dhamija and Dr. Kumar. And let me also quickly take in closing comments from Aman Pawar and Geeta Bhatt. And I'll give the last word to Raghav Chadda so that he can listen to everyone and then give the last word. Geeta Bhatt, will begin with you. Very quickly, what else could have been done given these circumstances?
Well, Sanket ji, I think the first thing is that government should be forthcoming in putting up the facts in a right manner. There is an alarming situation in many states, and that is Delhi, as we know, it is at number 3. But let us look at the problem and try to resolve it rather than looking at such kind of detours where we are trying to deflect the attention from the actual problem and trying to create such controversy.
That's exactly why it's a proposal, and he wants suggestions.
Sanket,
Aman Pawar, very quickly. Yeah.
Sanket, I don't think this is a practical and implementable solution or a proposal, because if tomorrow the central government announces that we will not allow Delhi Heights to be admitted in our hospitals which are in Delhi and we'll open them only for the rest of the country, we are going to land up in a bigger problem. And I think I agree with both the doctors that where on one hand the number of cases are increasing exponentially in Delhi, the number of containment zones are going down by the day. I don't know how the Chief Minister's office is functioning. So they need to pull up their socks and they need to actually augment their facilities, because when we see the numbers, maximum number of patients in Delhi are running towards private hospitals or central government hospitals. So Delhi government hospitals are really not doing the job that they need to close Delhi for others.
Okay. Last word, Raghav Chadda.
Yeah, I would not respond to the lies uttered by the Congress spokesperson because they are nothing but lies. I'll stick to my facts. A question was raised regarding the deaths that have happened in Delhi.
Okay,
I would like to...
Aman, you've spoken. You've made that point.
You should not dodge the question.
Let's have a civil debate with civil people, Sanket.
Last word,
Sanket, you see, a petition was filed before the Delhi High Court challenging the authenticity of the deaths, numbers of deaths that the government of Delhi publishes. The Delhi High Court division bench headed by the Chief Justice dismissed that petition and said that these allegations are baseless and the figures put out by the government of Delhi are authentic. So therefore, I think this dirty politics of the figures that are being published should stop. That's one. Number two,
these are your figures, Mr. Chadda?
as far as the government of Delhi hospitals are concerned, they are working and they're working at an optimum capacity. It's serving the people of Delhi. We are saving lives. The mortality rate in Delhi is perhaps the lowest in the country. And yes, I agree with the BJP sympathizer on the panel when she says that the state of the city is alarming. Yes, the situation is very much alarming, and therefore we are preparing for the worst, and we need to protect our people. We know that the situation is bad. That's why we are at number 3, right behind Maharashtra and Tamil Nadu. And please, for heaven's sake, look at your states. Prepare your infrastructure rather than questioning Arvind Kejriwal. Every time you appear on television, he is one chief minister who is doing extremely well and saving lives.
We have seen the numbers, how well he is doing.
Needs to stop.
Raghav Chadda,
and what we need to do
Aman
is
Pawar,
work
as well as
together
Geeta Bhatt. I have run out of time in this
states.
discussion. I have heard all of you all. Thank you so much. Again, at the end of this debate, I want to repeat, it's a proposal. It is a proposal only for COVID-19 patients and COVID-19 hospitals. It's not like anyone with other illness will not be allowed treatment. It's only for COVID-19 patients, but it is a proposal. So, 5th June, Raghav, am I right? Till 5th June, people can give in their suggestion. And
yes, and every panelist on the panel should also give their suggestions.
Okay,
since they
do
feel
give
so
your
strongly
suggestions,
about
Aman Pawar and Geeta Bhatt.
Yes,
I hope you will give your suggestions.
Definitely, be rest assured.
Okay, fantastic. Great to hear. Aman Pawar, Geeta Bhatt as well as Raghav Chadda. Thank you so much for joining us on discussion number 1.